Rick, thank you for doing this today. I really appreciate you being willing to share your story, hopefully help spread the word about prostate embolization to all the people that are out there suffering with urinary symptoms from prostate hyperplasia. So thanks for joining me today.
You're very welcome.
I thought we'd just start out, Rick, with talking about the sort of symptoms that you had before you came to see me originally and your experience trying to get treated with urology.
Well, let me kind of put it like this. Have you ever watched a dog chasing his tail?
Of course.
It just really doesn't get him anywhere, does it? I felt like that for probably 12 years. I didn't really start realizing that I had a problem until maybe about 12 years ago. I went to a doctor down in Homestead, and he said, it looks like you have after his probing and prodding and all the other things the doctors have to do, he says, I think you have an enlarged prostate. He sent me out to get the scan that you all did for me as well. And he said, yes, it's enlarged. So he gave me some medicine, and the medicine was kind of like the dog chasing its tail. If I didn't take it, I couldn't urinate. If I didn't take it, I had to urinate. I mean, there was just no way to make it right for me. And when I was taking the medicine, it kind of helped you to go to the bathroom, but it didn't stop or slow down the necessity to go all the time. And it didn't also help you to relieve your bladder completely. I saw something on television. They were advertising this new program called UroLift. So I found the first doctor I could in Plantation. He went over the process with me, sent me through about an hour and a half of his probing and prodding to determine I wasn't a candidate. Met another fellow where I work. I've been working in senior living for a long time, who went through the PAE, and it didn't work for him because he couldn't connect both sides of his prostate for whatever means. He went to a doctor. They did the rotor-rooter on him, and as a result of that, he has been incontinent for the rest of his life.
Yeah.
They hit some nerve in there that did something that scared me. I didn't want to take that kind of a chance.
Yeah.
So I started looking for options. And you do, by the way, need to market better, because I had to hunt for you. I couldn't find anybody that would do it. So when I finally got a hold of someone from your office, I said, listen, I don't know about this procedure, but I would like to talk to the doctor and have him explain it to me. And the rest is history.
Yeah, well, good. So just to clarify, I think when you said rotor-rooter, you probably are referring to the TURP procedure, which is transurethral prostatectomy.
That's correct.
You're right. Unfortunately, the person you spoke to was one of the unlucky ones. There's about a 1%, maybe 1 to 2%, depending on who's doing it, risk of permanent urinary incontinence after one of those procedures, and also about a 15% incidence of permanent erectile dysfunctions. It's a good procedure. It relieves the symptoms for most men, but it does have those side effects. And for people in your age group, certainly, and older, those are risks that a lot of men aren't willing to take. That's one of the problems with TURP and the other urologic procedures that involve putting something up the urethra and removing tissue. I think you were on Proscar for several years.
Similar. Yeah. It was called docetaxel.
Mm-hmm. Yeah.
It was an alpha blocker. Is that what that is?
Yeah.
Yeah, that's what it was. Long time.
You had very mixed response to that, sounds like.
Well, the thing about that particular medicine, as the years progressed, and I think as the enlargement continued, it started having less and less of an impact for the good.
Yeah. I believe the UroLift probably you were not a candidate for because your prostate was a bit too large.
Probably so.
Unfortunately, the other issue with UroLift is it's only sort of pushing some of the prostate tissue out of the way. And as the prostate continues to grow, it frequently the problem recurs. We actually see quite a few people that have failed or had early recurrence after UroLift. That's one of the problems with UroLift. It is good from the standpoint of having a better side effect profile, so you don't have to worry about the erectile dysfunction and incontinence issues that you do with the TURP, but it doesn't seem to last very long for a lot of men. So that's a problem with UroLift. Out of curiosity, did you ever have a cystoscopy with the urologist?
He did something like that.
Yeah. What was that experience like?
It wasn't a very good experience at all. And I would say that I felt like I was definitely having to feel sorry for my wife for whatever she's had to go through for her entire life, because I was definitely feeling it. But it wasn't pleasant. Then he had to put something up inside of me to see how long I could hold the liquid and the water. And it was just an unpleasant experience, and I didn't feel good about all of it.
Yeah. That's one of the really uncomfortable aspects of a urologic visit is getting a cystoscopy. They generally don't sedate for those. Most men don't do well with having things shoved up their urethra. It's very
No.
unpleasant. Yeah. When you came to see us, tell us a little bit about your experience in the office and what we did to get you ready for the procedure.
You know something about your office, and I've gone to the doctor's offices many years and many times in my life. The doctor's office, the initial contact with the lady you have out front was just absolutely very comfortable. She was very sweet, very kind. And I think at the time we were having to put a mask on, and she was explaining how I would have to do that when I went. And she was a very nice lady. She made the initial contact with you very pleasant for me. Good propriety.
Yeah, we have a great group in the office. We're a low volume office, so we try to make each and every patient encounter as personal as possible. And I think that's really missing in healthcare these days. So that's the way I like to practice, and patients appreciate it.
Well, you need to be careful with this marketing then, because you might just have people waiting outside in line.
Yeah, well, it's a double-edged sword, I guess. After we did the PAE, tell us about the procedure itself. Do you remember anything from the procedure? Do you recall immediately afterwards what it was like?
You know, I think it's good that I don't remember whatever you were doing. So no, I don't really. I mean, I have like a moment of awakening for a second or two, but not much. I know when you capped off the vessel, you had to put some pressure on my leg that's about the only thing I remember that was uncomfortable. And afterwards, it wasn't near as bad as what I anticipated.
Good, good. You know, I know we talked about this previously, but we did give you a little sedation. We don't put you to sleep. We just give mild sedation. And at any time, I could talk to you. And, you know, if I needed you to hold your breath or do anything like that, you were awake enough to do that. But you really sort of snoozed through the whole procedure. We did put a Foley catheter in you during the procedure, and we removed it before you were fully awake, so you didn't have to experience any of that. Procedure took about an hour. What about when you went home? Did you have any? Oh, and you had mentioned you felt pressure when we pulled the catheter out. That's because we hold pressure over the puncture site in the femoral artery just to make sure you don't bleed. We put a little plug in there, a little bit of collagen that helps minimize the risk of bleeding for the first, 6 to 8 hours.
That wasn't anything that troubled me. I guess I'm just a sissy when it goes to going to a doctor.
Yeah, that's what most people notice because you're sort of coming out of the anesthesia at that point. And that's really the only thing, even if you were wide awake, that's the only thing you'd feel throughout the entire procedure. What about recovery once you went home? Anything special, any pain or other issues?
The only thing that I experienced was obvious things that you had reported that I would. A little discomfort and urination for the first day.
Mm-hmm.
I do say discomfort, no pain.
Yeah.
And of course, having different color urine for a while because you gave me something, changed everything. So, but no, I was very pleased with the whole thing.
Good. Yeah. Yeah. We put you on a little medication just to minimize. A lot of people get a little more irritated, so they feel like they have to go more frequently for the first day or so. So we give some medication that minimizes that sensation, and it happens to turn the urine an orange color. Most people are more bothered by that than anything else. That usually lasts 24 to 48 hours, and then afterwards, you don't really even know that you've had anything done. Do you remember how long it took before you started to notice improvement in your flow and frequency?
Well, I think that it gets better as it continues, as it's getting better the more time that has passed since the procedure. And I suspect that has to do with what you explained also to me, is that what's happening is that the prostate is shrinking as a result of what you did. And I can see as time progresses, it becomes better for me. Initially, I was excited because of the fact that I was not experiencing the intensity to go all the time. And I can tell you now, I don't wake up in the morning now and have to go to the bathroom 5 times before I go to work. I can drive to work without any fear of having to go really bad before I get here. So you've made a big difference in my life, and a lot of people might not understand it, but this procedure to me, it was life-changing.
Well, that's great. That's why we do it. So it's really nice to hear that you're doing so well. If you have some interest, I have some pictures from the procedure I thought I might show you.
Sure.
Because I don't think we ever had a chance to review any of this. Let me see if I can figure out how to.
While you're doing that, I've told lots of folks that before they make their decisions, they definitely need to consider this procedure.
Well,
because it's very not near as stressful as what the other things were in terms of what you just explained as far as how they do it.
Yeah, I think hopefully more urologists are sharing this option with their patients. Patients are becoming more educated with regard to selecting procedures, which is, definitely one of the positive aspects of Google these days.
Yeah.
Yeah. Okay. So let me see if I can do this. This is a video of the left half of your pelvis. This is the hypogastric artery. This is one of the large arteries in your pelvis. If you look carefully, you can sort of make out the right hip here and the left hip here. It's sort of this is called a subtracted image, which means we take an X-ray, we subtract it, and then we inject the X-ray dye
Oh,
and we subtract the X-ray from the images with the X-ray dye, and so you can see the dye really well, and you're not distracted by the bones and the other things in the image. You can see that there's a lot of arteries here. Just to give you a basic idea of what is involved in doing this procedure, you can see there's a bit of the catheter is here. The catheter actually goes from the right. You have to look at this as if you're looking at yourself in a mirror. So this is
okay.
your right side, this is your left side,
Mhm.
and the catheter goes up out of the picture and over the aortic bifurcation into the left internal iliac artery, which is one of the main arteries in the left pelvis. And we inject the X-ray dye, and you can see there's a whole bunch of arteries coming off here. And this little guy right here is the prostatic artery. We start by trying to find it on this big image, and then once we've done that, let me see if I can go to the next image without having to. Yeah, okay. Then once we get into that, you can see that we're now injecting that artery, and all of this dark blush here
Mhm.
is the left half of the prostate. So once we get into a position like this, we start injecting these little 100-micron diameter beads. Those go out into the very tiny arteries that are too small to see on this image and block those arteries off. So we get complete blockage of most of the prostate circulation. And you can kind of see there's almost a straight line right down the middle that demarcates the left side from the right side. So we have to do this on each side. We injected those particles, blocked this off, then we went over to the right side and did the exact same thing. I just thought that might be
Mhm.
interesting for you to see. This procedure, just to be fair, present a fair assessment of the procedure to people that might be watching. One of the potential pitfalls of this procedure is that compared to the urologic procedures where they're removing a bunch of tissue, this procedure can sometimes have a limited lifespan. On average, we see about 8 years of improvement from these procedures. And the reason that is because over time, sometimes parts of the prostate that don't get fully blocked can continue to grow. When you've got tissue like this that's growing, it can find other sources of blood
Resources,
supply.
yeah.
At some point down the road, symptoms can potentially recur. Sometimes you can go back in and repeat the PAE. Sometimes technically it's not possible. Whereas you might get, 20 years out of a transurethral prostatectomy, you might get only 7, 8, 10 years out of a PAE. And so that is a drawback for PAE, but I think personally, for me and for most men that I talk to, given the side effect risks of the more invasive procedures, this is preferable. And hopefully 7 to 10 years down the road, when people are needing something else, there'll be better options available if a repeat PAE isn't possible. Yeah, anyway, so I think that would be interesting for you. Any questions you have for me or anything else you'd like to tell people that might be watching this video?
No, I went out and did my own video and put it on YouTube shortly after the procedure. And I've had some people ask me about it, not knowing all of the non-layman sort of things you just talked to me about. I just express it before you go out and you make a decision based on, the urological function from a doctor on that end. At least look into this because it's certainly it's worth looking into and it might be worth doing because it certainly made a change for me that was very positive.
Great. Well, thank you again, Rick. I really appreciate it. I'm so happy that your symptoms are gone and you're back to living a normal life.